viewers, today we are going to study about the paraneoplastic syndrome. So, what are the paraneoplastic syndrome? You can say them to be a group of rare disorders which are seen. 1 minute. Okay, you can say that they are a group of rare disorders that occurs when the immune system has a reaction to a cancerous tissue. For example, there is a person whose name is A and this person is having cancer. He might have certain other syndromes and disorders that are the paraneoplastic syndromes. Remember, these syndromes that he is having has got nothing to do with the cancer. Okay, they are not related to his cancer. They are not caused by the cancer in his body. They are just some accessory syndromes that could be seen due to this condition. So they cannot be explained that they are spreaded by a local or a metastasis. Remember, what is metastasis? This is breakdown of the tumor and then the tumor travels to various other parts of the body. Okay, that is what metastasis is. Here these diseases are not caused because of this condition. Okay, they are not caused because that the existing tumor, it got broken down and then caused this syndrome. No, it is just simple rare disorders which can occur in the body if the body is having any cancerous tumor present in it. It's basically a immune system reaction, so it cannot be explained by a local spread or a metastasis. Moving to some of the disorders, just overview of before we dive into the topic. We are going to study about the PNS endocrine, that are the paraneoplastic syndromes of the endocrine region, and then nerves and vessels, nerves and muscles, PNS nerves and muscles, and lastly we are going to have PNS heart and blood vessels. Okay, so we would be studying these disorders into these three headlines. Moving to the first one, that is your paraneoplastic endocrine disorders. Now in endocrine disorders, the first thing you have is hyperglycemia. You all know hyperglycemia, right? Now the next, okay, wait, it is going to be hypercalcemia. Okay, so the hypercalcemia condition is usually seen due to the increase of the PTH hormone. Secondly, it could be commonly seen in the breast carcinoma and the squamous cell carcinoma of the lung. Now, hypercalcemia is a condition in which the calcium levels, they increase a lot in your body. Usually the most common cause associated here is the increased PTH hormone. Again, could be seen in the breast carcinoma and the squamous cell carcinoma of lung. Coming to the next disorder, which is a syndrome known as Cushing syndrome. It is a very famous syndrome. I know all of you know about it. Next, it is due to the increased ACTH level. Increased ACTH is basically adrenocorticotropic hormone which increases and leads to your Cushing syndrome. Okay. Now again, it is seen in the squamous small cell carcinoma of the lung. Coming to the third one, that is the syndrome of inappropriate antiuretic hormone. So it's a long name. Just remember it, that a syndrome which is caused due to inappropriate antiuretic hormone. Okay, it is again seen in the small cell carcinoma of the lung. So when we talk about the endocrine PNS, we have three disorders. First is hypercalcemia, then we have Cushing syndrome, and then we have a syndrome related to inappropriated uretic hormone. Coming to the PNS nerves and muscles. In the nerves and muscles, the first disease we have here with us is LEMS. This LEMS is basically Lambert-Eaton myasthenic syndrome. So what exactly happens in this condition is, for example, this is your nerve. Okay, what will happen? Calcium is going to enter inside the nerve. When it enters inside the nerve, the ACH is going to be released. As the ACH is released, now keep this in mind, the ACH is released. On the other hand, the muscles which are present in your body, they have the ACH receptors. Okay, these are the ACH receptors. What will happen? This released ACH, it will come to these ACH receptors and it will bind to these receptors. As soon as they bind to the receptors, there will be production of a reaction, that is muscle contraction. Okay, so as soon as the ACH is binding to the ACH receptors, there will be muscle contraction which will be seen. So what exactly happens in this is what happens in a normal person. If I talk about in LEMS, no calcium production takes place in LEMS. So imagine there is no calcium forming. So when no calcium is forming, no ACH will be released, no binding will happen, eventually no muscle contraction happens, and this leads to muscle weakness. Okay, this leads to muscle weakness. Next, what we have in the PNS muscles is that is the stiff man or the stiff person syndrome. Now here the name itself is telling you the person is going to have a rigid muscle body. The muscle activities is going to be completely stiff. So the major portion of the patient's body or the person's body is going to be stiff, as the name suggests, including the muscles of the trunk, arms and legs. Some other symptoms of the condition could be, there could be muscular rigidity even of the facial muscles. So taut facial expressions will be seen, difficulty in breathing because again the thorax muscles could also be affected, stiffness in the trunk and lumbar muscles. Then you have proximal limb weakness, muscular spasms will also be seen, fracture of the bone and joint dislocations could be seen. Lastly, there would be generalized anxiety disorder, depression and specific phobias. Imagine your whole body is stiff, obviously you're going to be really anxious, so anxiety is going to be there. You might have phobia sometimes in the muscles. Even if we sit in a same direction for like really long time, our muscles, they go to sleep mode and it becomes so difficult for us to stand. We are literally scared to stand. So that kind of condition. Lastly, it is the cerebellar degeneration which is seen, and this is commonly seen in the Hodgkin's lymphoma. So this was about the PNS of your nerves and the muscles. Now we talk about the PNS of heart and blood vessels, like the paraneoplastic syndromes which are seen in heart and the blood vessels. First we'll talk about heart. For example, adenocarcinoma is the cancerous condition present in a person's body. Now what will happen? Mucin is going to be produced in such condition. This mucin, it is going to enter the blood flow, and as it enters the blood flow, it is going to reach the heart. Okay, through flowing via the bloodline, it will reach the heart. As soon as it reaches the heart, there is going to be infection of the endocardium layer of the heart, which will happen because of this mucin, and this leads to a condition known as non-bacterial thrombotic endocarditis, also said to be NBTE. Okay, so this is how inflammation of the endocardium is happening in the heart, leading to a PNS heart condition. Coming to the blood vessels now, again mucin is produced here. It travels via the blood flow to the veins, and inflammation of the veins happen, that is known as phlebitis. Okay, as soon as any injury occurs because of this inflammation, now what you have read this now, in inflammation the first sign that happens is the thrombus formation. So after inflammation has occurred, the first thing that happens in the body is the thrombus formation. So as soon there is any injury to these veins, what will happen? Thrombophlebitis condition will be seen. If only simple inflammation is there, inflammation as in the veins are getting infected, then you are going to say it as phlebitis. If there is also injury that has happened, that will lead to thrombophlebitis, because thrombus formation will take place at that area. As you see, this can migrate into different parts of the body via the bloodline, so it is also said to be migratory thrombophlebitis. Okay, so these were few disorders which are related to the neoplastic syndromes. And again, the paraneoplastic syndrome, remember, it has nothing to do with the existing cancer. It's just that not the existing cancer is going to break down and form this disease. It's a separate disorder which is seen in the body only as an immune system response. Okay, so that was all about the paraneoplastic syndrome. Still, if you guys have any doubt, please let me know in the comment box down below. Suggest some more topics you want to see the videos on. Thank you so much.